Dr. Yap here. Today I want to show you the Deadbug Relief position, or as we like to call it here in the clinic, the supine 3-month relief position. I really like this position during episodes of low back, stiffness, tightness, pain, and also very much for the neck, tightness, stiffness, and pain. I find this relief position really useful to do during those acute episodes and especially before bedtime. So I'm going to be using an exercise ball here, but you can very well use the end of your bed as long as it's not a super high bed, your couch, or a chair. To set it up, you're going to get on your back first. Now, if you're dealing with back pain, you probably don't want to dismount like this, like a reverse sit-up, but rather to get into position, you're going to get on your side, like so, and then you're going to gently lower yourself to the ground. Then you can get yourself into position, keeping a gentle brace through there. You want your knees to be just above the hip or slightly inward this way. Step 1. Step 2, you're going to take your hands and you're going to pull the back of your neck to gently elongate. And almost you can feel a gentle stretch through the back of your neck here and almost like a chin tuck. If you find this position hard to be in, you can take a pillow or a soft mat and place it on this back of your head to gently raise that space. Now you use that if your neck is stuck in this position. But if you're able to get elongation through there without sacrificing the neck position, then you don't need a mat. Number 3, take a few breaths to gradually lower this space in your rib cage. Now you'll find a lot of people will tend to be overly extended like so. So take 2 to 3 breaths, and with the gentle inhale, and as you exhale, let the chest be heavy, kidneys to the floor. And then do it in a gradual process. Another breath in. Once you've got your rib cage down and relaxed, the chest is relaxed, and your kidneys are essentially in contact with the floor, your hands can rest by their side, or I like to put my hands just above my hip bone. Thumbs in the back and the index finger in the front, so that I can give myself some feedback. And the feedback that you want is to create gentle, lateral, almost like a 360 expansion through the entire abdomen. So no sucking in of the belly here. I want to see how well you can create abdominal expansion, but in a 360-degree manner. So take 2 to 3 seconds, inhale, fill that space, and let it all go. Start with 3 sets of 30 seconds. If you like being in this position, then you can work up to a minute at a time. Now, I like the exercise ball because it requires a little bit of work on my lower extremities, but also because I can easily modify my hip and knee angle. So I find that as we go out a little bit more, it tends to create a little bit more extension in the low back, and that might not feel good for you. So you want to play around with it, nice and gentle, to find a range at which point you can feel sort of your low back gently settle into the ground. Not necessarily flat to the ground. We want to maintain a gentle, normal lordotic curve in the low back. And from there, just breathe. Nice and easy. If you're feeling adventurous, when you're done with this relief position and you want to create some more activation and stability through the core, without changing anything, all you can do is you can lift one leg and breathe for 2 to 3 seconds, drop that leg, lift the other side, breathe, 2 to 3 seconds. And you can work sort of that leg lifting as part of the active portion for this exercise. Now, for those of you dealing with neck pain or low back pain, to get out of this position, first, get the ball or the chair away. If you're on a couch or a bed and it won't move away from you, what you want to do is you want to support the neck, bring the elbows inward, and then keep a gentle brace in your core, and you're just going to roll off to your side. And then from there, you can come out of that position, use your hands, and push you back up into an upright position. This is the Deadbug Relief position, and at the end there, I added in an active component to challenge the system a little bit and hopefully create more stability around that low back to reduce your tightness and pain. Give this a try. Comment below if you have any questions, and have a great time. Take care.